Good morning to one and all present here. Firstly, I would like to thank the SAGES for giving me this opportunity to present our work titled The Incidence and Short-Term Outcomes of General Surgeons Performing Elective Minimally Invasive Bariatric Surgery. We reviewed the MBSAQIP database for this. We have no financial disclosures. Going ahead, so looking at the years in numbers, there is a significant rise in the number of bariatric surgery procedures done across the United States, as shown here, almost up to 256,000 in 2019 when it was last determined, and it continues to go up. However, is this all happening at the places it needs to be? If you look at the population that is morbidly obese, or patients with obesity, as they say now, in the United States, there is a significant population that's actually not having access to bariatric surgeons. And hence, but if you look at it, the bariatric surgeon presence is actually not in the spots where there is the highest levels of obesity. So it's interesting to note if there is a role for general surgeons, in fact, in bridging this gap. So as we know, bariatric surgery has been proven to be the only therapeutic modality proven to produce long-term weight loss and reduce associated comorbidity. And these are now mostly being performed by surgeons who are metabolic and bariatric specialty trained. And our aim was to quantify the incidence of bariatric procedures being done by general surgeons across. And we used the MBSAQIP database between 2015 and 2019, and all the procedures which were done minimally invasive were included, and 30-day outcomes were analyzed. So we accrued about 630,000 patients, and about 2.5% of the cases were actually done by general surgeons. About 16,000 is what we could accumulate. If you look at the demographics, not much difference, very minimal difference in racial features. Other than that, the BMI at surgery was similar. And again, if we see the patients operated by metabolic and general surgeons were having more comorbidities than the ones done by general surgeons, although ASA4 was 8%, which is versus 4 on the general surgeon side, which was interesting. If you look at the multivariate analysis, the ones which stand out here are the 30-day readmission rate, so about 1.15 times the readmission rate, and a decrease in superficial surgical site infection is what we've noted. We had an limitation that we didn't have a clear cut idea of what the bariatric experience of the general surgeons was. And to conclude, so we found out about 2.5% of all minimally invasive bariatric surgery procedures were performed by general surgeons, and the patients in the general surgery group had lesser comorbidities, and there was about a 1.15% increased risk of 30-day readmission. However, no significant difference in mortality or morbidity. Thank you.